Bom, tenho um prazer de estar aqui com a doutora Ellis. Joffe Ellis, que foi esposa de um dos maiores psicólogos, né, que é o Dr. Albert Ellis, que teve a sua teoria racional, emotivo-comportamental e que foi pioneira das terapias cognitivas comportamentais. E aqui em Nova York eu tive a oportunidade, o prazer de estar com ela e fazer algumas perguntas e conversamos, mas o que eu quero deixar registrado é fazer a seguinte pergunta, né? Quais são os fundamentos, para quem não conhece, os fundamentos, a base da teoria racional emotiva comportamental. So, Dr. Ellis, Joffe Ellis, what are the essentials of the RABT?
Okay. Well, by the way, I loved hearing your Portuguese, and I guess people watching this, I hope they understand my English, but it's such a romantic language, isn't it? And I'm
sure.
talking here to your beautiful wife, Gabriella, who's filming this. The essentials of RABT, and I love RABT because, in my view, it's the most holistic of all the cognitive approaches. And of course, rational emotive behavior therapy is the foundational cognitive approach. My husband's work heralded in the cognitive revolution in psychology. So the essentials are, number one, it's not what happens that creates our emotional destiny, but what we tell ourselves about what happens that creates our emotion. Number two, when we think in healthy, rational ways, we create healthy emotions. In particular, I'm talking about in relation to adversity, when bad things happen, when we don't get what we want, or we don't get what we want and we do get what we don't want. When we think in a healthy way, we'll create healthy emotions. RABT beautifully teaches us the difference between the healthy negative emotions and the unhealthy ones. Essentially, the healthy ones are appropriate when bad things happen. Like, by the way, this is a very New York environment, not particularly quiet. We're in the Lincoln Center. So healthy emotions when bad things happen include sadness, grief, healthy anger, concern, regret. But the unhealthy emotions which we create when we think in unhealthy ways include depression, anxiety, shame, rage, guilt, jealousy. You see, those emotions can paralyze us, debilitate us. The other ones are healthy. If someone I love dies, it's healthy that I grieve, that I'm sad. But that's very different from depression, where I don't function in my life in a healthy way. So RABT, and it's very important to underline this because some teachers wrongly are saying RABT is not about emotion, it's about thinking and behaving, and that's false. RABT is about healthy emotion. It acknowledges the importance of happy and not so happy but healthy emotions.
There's no behavior without feelings. There's no behaviors without feelings.
Indeed, and RABT gives us the tools for creating the healthy feelings. And then the next main aspect of RABT is its strong emphasis on the importance of unconditional acceptance, unconditional self-acceptance, unconditional other acceptance, and unconditional life acceptance. I do not know of an approach that so fully emphasizes that compassionate philosophy as well as emphasizing the importance of taking action and using the tools that he teaches. So I think that they're the main, in the few minutes we have, the main aspects.
Eu espero que tenha compreendido, né, entendido esse ponto principal da terapia racional, emotivo e comportamental. E tem aqui 3 livros fantásticos, infelizmente não tem tantos em português, né? Mas esse aqui é um livro adorável dela, que ela escreveu junto com o Dr. Albert Ellis. Okay? Esse daqui. This book you wrote with Dr. Albert Ellis.
Yeah, well, we started it months before he died. So really I mainly did it, but it's full of passages directly from him. So he and I were like one unit, so it's really nice. But I mainly did that. And this one I did the research for, and this one
One was a research.
I researched, but he's the main author. And this one, by the way, there are 85 books that he published. And this one, I did the final chapter, and he died before he could complete it, so I put it together.
Thank you so much for your attention.
You're welcome. You said you had 2 other questions.
Right. The other question is the REBT the first kind of behavioral cognitive theory?
Yes. Now, it's important to acknowledge the influences in my husband's work. So his work was influenced by ancient Stoic philosophers, Eastern philosophers, Lao Tzu and Confucius, Buddha, Gautama Buddha. The philosophers, by the way, the Stoics, Epictetus, Epicurus, Marcus Aurelius, Seneca, and some. Then contemporary philosophers of his time, of my husband's time, Dewey and Bertrand Russell. Alfred Adler, the psychiatrist, some of his ideas my husband appreciated and included, and there were others. So, but my husband was the first one to put together a specific cognitive behavioral emotive approach, and he first presented it in the early 1950s, and the people of his time, mainly psychoanalysts, were and called him stupid and simplistic and worse things, but he persisted, and now the cognitive approach is more widely used than psychoanalysis. And Aaron Beck acknowledges my husband as having been a huge influence. This year at APA, American Psychological Association annual meeting, someone asked Beck the question, what was the influence of Ellis?
I'm affiliated to APA.
And Beck said it would take him an hour to answer that question. And in the autobiography, there's some of their correspondence. So Beck's work came in the late 1960s, more than 14 years after my husband's. So yes, it's the first major cognitive approach. And from it, not only cognitive behavior therapy, DBT, acceptance commitment theory, positive psychology, coaching, so many things were influenced by his genius.
So the bottom line of the REBT is?
We create our own emotions. Life is short. Let us learn how to minimize emotional suffering, because life will contain loss and suffering. Let's not add to it, and let's maximize joy in this one life. And an important emphasis that I am giving to REBT when I teach it is the importance of being grateful, of gratitude. So, bottom line, let's be grateful for the life we have, not add any emotional suffering, let's create the maximum joy.
Sure. Thank you so much for your attention, and I hope that you enjoy our conversation. Okay? Thank you very much. Espero que vocês tenham aproveitado bastante e a gente se vê.